Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Rachel Colasino, and my guests for today's show are Nancy Chuck, Diane O'Neill, and Kate Bryant. Welcome.
Nice to be here.
Thank you. Thank you for being here. So our topic today is wound care, which I know that we don't have a clinical audience, but the three of you have such passion for what you do around wound care, and I think it's going to be an interesting conversation. We'll talk about why wound care is so important, especially in nursing homes. We'll talk about new treatments that have been around for centuries, and we'll talk about why wound care nurses, why you call yourselves detectives. So here to help with that discussion, Nancy Chuck, you're a nurse practitioner from the Center for Wound Care and Hyperbaric Medicine at Berkshire Medical Center. And Diane O'Neill, you're a wound care certified nurse and clinical reimbursement coordinator at Williamstown Commons.
Yes.
And Kate Bryant, you are also a wound care certified nurse at Hillcrest Commons here in Pittsfield, so thank you. So Nancy, I want to start with you with our discussion. Why does wound care matter?
Well, a lot has changed in wound care in the last several decades. There's a lot more research going into wound care, and now we have more evidence-based treatments, and that's definitely important when you want to heal a wound quickly. Many wounds heal without a problem, but other wounds experience what we call stalled healing or delayed healing, and we have to discover what the impediment to healing is. Common things that we find, maybe that a person doesn't have adequate circulation to where the wound is. They may not know that at the time. Another reason is they may be on medications that prevent wound healing, such as prednisone. Long-term prednisone use does affect wound healing. Some people are on anti-rejection medication, which does interfere also, or immunomodulating medication. So, we have to look at medications. And another reason, some people do experience a chronic swelling in their lower extremities, which we call edema, and that is another common reason why wounds don't heal. So you have to address the swelling before the wounds heal.
So sounds like a wound care greatly impacts quality of life, no matter where somebody is, whether they're at a nursing home or whether they're out in the community.
Definitely. I mean, just the ability to ambulate. If you have a wound on your foot that's painful, where you have to be non-weight bearing, that affects your ability to get around, to drive, your ability to work. Some wounds are painful, so the sooner we can heal them, the better. There is definitely a big impact. And if you have a chronic wound, there's an element of depression. It's tough, to be away from your usual activities. Some people, are home and don't have family or friends. So it's definitely, a cause for depression too.
And could lead to other complications too, it sounds like.
Exactly. When diabetics have a high incidence of delayed healing wounds, so it's very important to treat those early. Just a few statistics, 15 to 25% of diabetics will eventually develop a foot wound, or we call them ulcers. And if they're not treated early on inappropriately, 15 to 24% of those patients may go on to need an amputation of some sort. So
it's important.
Yes, definitely important. Yeah.
So Diane, I want to ask you too, I know when people are choosing nursing homes and considering going into nursing homes, they're thinking about a lot of different things, but why is wound care something that they also need to be considering? Why is it so important?
Well, we take a multidisciplinary approach to wound care. We involve PT, OT, our nurse practitioner. We have Nancy who comes to Williamstown Commons weekly to assist me. We have the Wound Care Center, and we want to give these people, these residents of ours, the ability to be able to stay in their own environment. They have enough to do with worrying about, getting stronger, getting better to go home, and to add an additional burden on of sending them out to a wound care center or to a physician's office is very strenuous for these people. They're elderly, they're mostly elderly. We have a lot of people that come in for, that have arterial wounds and vascular wounds. We have diabetic foot ulcers, people that, didn't have help out in the community and are coming to us and reaching out to us to assist them to get better. Wound care is very specialized in our long-term care facility, and it's a process with systems in place for evaluation, and we chronically evaluate the treatments and the progression of them or the lack of. It pulls the whole team together. And it's not just one person, it's everybody all involved in the wound care management of the people in the long-term care facility.
Can you tell us more about that, about everybody working together for that wound care or the wound care management?
Yeah, we have the Nancy that comes, we have the physical therapists and the occupational therapists that look at modalities that the person may need, maybe a specialized chair cushion. They may need some sort of a special brace or compression. With the vascular ulcers and arterial ulcers, we do, check their pedal pulses and use Doppler studies, and we need the nurse practitioner and the physicians all on board with the whole management team, the whole nursing, right down to the CNA to let us know when things are changing or something's different. It's just a team approach to the healing process.
It's definitely nice to have a wound care nurse in the facility because I think you guys really pull things together, And I know both Diane and Kate are there full time, so
and they're happy to call us.
Yeah, so they really, there's constant monitoring of wounds. They know what the wounds look like, if there are any changes. They know, how to proceed. But it's pretty impressive, I think, and I think they deliver, great wound care.
It's very specialized.
Very specialized. We also have communication with Berkshire Medical Center. In addition to Nancy, if we need to speak to a physician there or one of the team nurses there for ideas or thoughts, we have the ability to do that also.
That's great communication.
Yeah, there's a lot of cross-communication because, like we all know, the wound care nurses at the different BHS facilities, so there's constant communication. If we have a problem, we call each other for experience, so it works out well that way.
So what is a wound care certified nurse, and what type of education is involved? I want to direct that to you, Diane, and to you, Kate.
So I did a 3-day accelerated course through the National Wound Care Institution. I went to Elms, Connecticut, and you live in your hotel room. It's a very extensive course that they teach you, how a wound evolves and how to take care of these wounds, and it's really intense, and it was a very difficult course. Berkshire Health Systems put me through the course. You need a 85% or better to pass. And then I went on to do, a few days. I did a course with Dr. Basile at Berkshire Medical Center. He provided us with some education, and I did some day training at Berkshire Medical Center also. And I've been doing wounds for about 8 or 9 years prior to being certified as a wound nurse.
Okay. And how about you, Kate? What was your education like?
I went to Boston for 4 days and studied intensely through the Wound Care Education Institute, and then I took my test as well. And it was a very intense course. It helped you to differentiate between different presentations. Wounds will some of them look very similar to something else, and you have to understand where it's coming from, or you will not be able to heal it. You won't be able to treat it.
I know you were saying that the difference it made for you was that it made you look at wounds differently.
Yes, it did. It made me see the big picture of them. It wasn't just a spot anymore, a physical spot. Now there were all these other things at play. It had to do with your nutritional state, many, many things like that, that we take for granted. Even just sitting, in one position for too long can create a wound. You really have to look at the whole person and the way they're living and what contributed to them developing a wound in the first place.
Okay. And Kate, I met you before I met Diane. I met you because you were one of our organization's Profiles in Care winners. So I met you through that program, and hearing you talk about what you did for wound care, I had never seen anything like it. You were so passionate. And then I met Diane and I met Nancy, and it was that same passion that you feel for what you do. And so I want to make sure that we're letting people know about how important that is and how passionate you feel about what you do. So Kate, what are the benefits of receiving wound care in a nursing home? I know we had heard Diane talk a little bit about why it's important that they don't have to leave, but can you talk a little bit more about the consistency that the patients have?
Yeah, I think it is more consistent care for them. They know who's going to be taking care of their wound regularly, because we see it every day. We know if it's getting better. We know if it's devolving. We will catch it quickly. Where if you have different people coming in, it's the first time they've seen it. To them, they there's nothing that stands out. They're just going to treat that wound, and maybe they don't know it's been devolving for a week and the treatment is not appropriate. And our patients, they get comfortable with us. They know that we're going to do everything we can to keep them pain-free. We all know, some of us have had more injuries than others, and it hurts, to heal, but you can cut down on a lot of the pain for the people, and they expect that. That's why when they see you come in, they're happy because they know they're going to be taken very good care of.
Yeah, it definitely lessens the anxiety, and it definitely shows. Yeah,
it does.
People aren't hesitant, when you're there to, provide wound care. And you're just a wonderful nurse too. You both are, really, because you do take care of the whole person. Yeah. You can definitely see that, and patients notice all your enthusiasm for wound care. They always comment on that. They really do.
They do.
And I think, Kate, you have some jokes that you like to tell.
Yeah, I try to distract people. I will tell them anything to make them laugh. Stress I view it as it's an impediment to healing. If people are very stressed out, their cortisol levels are rising, their healing, they can really make an impact negatively on their wounds. So yeah, I want them to be, I just want them to have the best experience possible. So yeah, I'll share all kinds of stuff to get them laughing.
So we're going to take a break, but before we do, Nancy, will you tell me about using honey? And this came up in our conversation, so it sounds like...
right. Honey has been around for such a long time.
Yeah, can you tell us about that?
BC. We still use honey. We still use honey today. It's like a medical grade honey. It's Manuka honey. I think it's made in Australia, but it's considered an antimicrobial. So it prevents infection, and it has other properties. So we do still use it today for certain wounds. So it's kind of interesting about that.
It sounds like it works.
Yes, it does. Yes. We have some good results with it.
Yes,
especially with some difficult wounds. Yeah. So it's one of our options to use in wound care.
Good, thank you. So we're going to take a quick break. We're going to hear a little bit more about Hillcrest Commons, and then we'll be back. Nice job, you guys.
Nestled between the woods of beautiful Burbank Park and the banks of picturesque Onoda Lake, in the heart of the Berkshires in western Massachusetts, Hillcrest Commons is just minutes from downtown Pittsfield, in the heart of the culturally rich Berkshire County. Hillcrest Commons Nursing and Rehabilitation Center offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the central Berkshire area. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Hillcrest Commons is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Hillcrest Commons, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. In addition, we also offer more specialized services, including a fully dedicated Alzheimer's unit, a geri-psych behavioral unit, pulmonary and ventilator-dependent care and therapy, and a full bariatric weight loss program. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Hillcrest Commons is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident and patient at Hillcrest Commons receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Hillcrest Commons Nursing and Rehabilitation Center, we're perfecting the art of superior care. If you or a loved one need short-term rehab, extra care after a hospital stay, or a nursing-supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-445-2300. We look forward to meeting you.
Welcome back. We are here talking today about wound care and about why wound care matters, especially for folks in nursing homes. So when we were preparing for the show, Diane, you were telling me that you see your role as a wound care nurse as being like a detective. So tell us about the investigations that you do.
So a lot of times the nursing staff will come to us as wound care nurses, and I'm sure Kate gets this too. You know, they found a wound or they found an area on somebody, or somebody has just come in from the hospital and has a wound. And so part of what we look at and what I look at, and I know Nancy does too, is we look at the person as a whole. So we're looking at their medical history. We're trying to investigate how this area evolved to begin with. It's a thorough examination of the chart to see what we've had in place or need in place for offloading devices. How do they present themselves sitting in their chairs? What can we do to pull rehab in to make them more comfortable? Coming up with a clear determination of how the wound evolved is very, very important for treatment, because the only way to treat the wound is to know how it began to begin with. what we did to see what we missed, if it's a facility acquired wound, and see what we can do to improve to make it better. We really, as wound nurses, take all of this personally, and it makes you very devastated, you know, to find a wound in the facility, because we strive for this not to happen. We work so hard to make sure that our residents have everything they need to prevent the wounds from happening. So it becomes personal to us as wound care nurses, and you know, I've shed a few tears over wounds.
Yeah, and that's that passion I was
Yes.
talking about. I can see it in your face.
Yeah.
And I know you both feel the same way. And
It's
And
difficult.
I think it's made a difference, because I think, you know, your pressure ulcer rates are low. I know you will be talking about that, but I mean, you know, the programs you have in place definitely have showed, you know, especially with your, evaluations this year. So
Yeah,
that's
we had
been a success, definitely.
Yeah, Williamstown Commons had only a 1% pressure ulcer rate, meaning that out of a whole year we only had one wound that
Wow.
was facility acquired. So we've done very well with the education of the staff and all of that with our wound care prevention. So.
And I know, Kate, Hillcrest too has seen some pretty good results as well.
Yes.
Yeah.
It's a lot of educating staff, bringing them up to date with current treatments and preventive measures, and they've been very receptive. You know, people go to work, they want to do a good job, they want to feel good when they go home. So, you know, we have a lot to work with, and they're very supportive of us educating ourselves and each other and continuing the education piece for the patients. They've been great.
Great.
And you've had many recent cases that have been successful. I mean, like major wounds
Yeah.
that have healed, that, you know, due to, you know, your program. So
It's
that's
so
impressive.
great to send people home when they've come in with really such, you know, painful wounds. It's nice to see them return to their lives and be happy, and they know that they're going to be okay, you know.
So we've talked a lot about treatment, and Nancy, I was hoping that we could talk about what kind of focus there is on prevention.
I think, you know, when patients are admitted to the nursing home, like Diane said, they're evaluated very closely, and multiple measures are put in place. You know, for example, if we have an elderly patient coming in from the hospital after orthopedic surgery, you know, we make sure that they have the appropriate mattress on the bed, they have appropriate cushion on the wheelchair. If they've, you know, if they need offloading to their feet or to any other part of their body, you know, that's provided. The nutrition department's always involved too, because the patient has to have good nutrition for healing. That's a major factor. So we always look at that. So I think, you know, many measures are put into place when the patient gets there, which has done a lot in preventing pressure ulcers.
Yeah.
So
Specialty mattresses and
Even-
all of that.
Even the condition of their skin,
Yeah.
everything. You have to look at it all. There's potential, you know, potential areas that are going to cause us problems if we don't address issues like dry skin. It's going to break, you know, so you can do that very quickly and avoid wounds to begin with.
And frequently there are like kind of informal wound rounds, you know, where we all get together. It'll be us, and, you know, physical therapy will be in the room, occupational therapy will be in the room, and we'll have this discussion with the patient, you know, and come up with a conclusion involving the patient. So everybody's really receptive to that, so which is very nice.
It sounds like everybody's working together too.
We have a
Right.
good team, and we
Yeah.
really have a good team
Right,
between
right.
all the facilities. We communicate very efficiently with each other, and Berkshire Medical Center helps us out a lot at the Wound Care Center too.
Yeah, I think that they're definitely a good resource. You know, like we were talking about, you know, there are a lot of gray areas in wound care, so I think experience is an asset, definitely. You know, and I know at the Wound Care Center, I'm the newbie there, so they Dr. Basile has been there since the wound care center opened, and many of the nurses have also. So they're wonderful people. They're a multidisciplinary team. So I think it's definitely a good resource.
Great. And before we close, Kate, I just want to find out how families are involved in wound care for your loved one. I mean, we've heard about how you meet with patients and talk with them, and how are families involved?
Well, we can spend time with them, and answer their questions. We can make them more comfortable about how to best treat their loved one. And we can really get them aligned with our vision as to how we're going to go about the plan of care, so that then they are more comfortable and they can go back and be supportive, and positive for their loved one, and they really can be more beneficial that way in their healing process. Everybody's
they just want to know their loved one's going to get better.
Yeah,
that's what you've said.
Exactly.
Yeah. Great. Well, thank you all for being here. It's been a great discussion. And this has been InfoSource, a presentation of Berkshire Healthcare Systems.